How's that?
That's great.
Okay, good evening. That's our first stab at the Hollywood introduction to our hangouts here. Chris is speaking tonight at bostonmedical.tv. This is one of the series of the the end of September. Chris is a developer for Evermed Research in Michigan, and he's got an app, a glass app, called Save a Life. And Chris is going to talk about it, and then we're going to chat. So welcome, Chris.
Hey, John. Thanks for having me. I appreciate that.
Sure. Okay. Well, it's all yours, Chris.
So I just wanted to chat a little bit about a product that we've been working on for a while. It came out of a project that Christian Assad and I started working on together when we first got Glass back in early 2013. So Christian Assad's a cardiologist, and he thought, wouldn't it be handy to have an application on Glass that could show you a little bit about what's going on with CPR as you interact with the patient. So, tracking compressions and giving you visual feedback of that compression rate that you're performing, playing a little tune in your ear so the BG's staying alive, and how that can, help provide confidence to someone who's giving CPR to make sure that they are giving compressions at the correct rate, the correct rhythm, and the correct depth. So out of that discussion has come a glassware tool called Save a Life, and the glassware tool has several different features to it. There's three metrics really that we're tracking with the tool on Glass, and that is to ensure that the CPR provider is providing correct rate of compressions, correct rhythm of compressions, and the correct depth of compressions. So about 70% of people that are actually certified to perform CPR cannot perform the skill. So right now it's a very subjective process where a CPR instructor basically watches you as you perform the skill on a mannequin, and they say yes or no, you either can or can't perform, and then they sign a card for you that certifies that you know how to do CPR. There's really no objectivity in the whole process. It's really dependent on the instructor saying that yes, you can or can't perform that skill. So this glassware brings in a new paradigm to this education process. So recently we've been accepted as one of 10 finalists for the American Heart Association's Innovation Forum. This is an event that's coming up in November in Chicago. And right now, today, we launched on medstarter.com. It's a platform for crowdfunding applications in the medical field. So there's 10 of us posted on their page. They have lots of other projects as well, but the 10 American Heart Association contestants were put up on the page today, and our project is one of them. If you go to medstarter.com, you can take a peek at the other folks, and everybody's got a blurb about what they're doing. There's a little video that talks about their project and how it can impact either cardiovascular disease or stroke, preparedness and response in America. And so our project is really focused on the instructors with CPR. How can we interface them with students and help them provide an objective measure of someone's performance when they're giving CPR? So using the glassware, Save a Life, we're able to put the glass device on a student's head, so it's a wearable device. You can see I've got one on here. It just sits over your ears like a normal pair of glasses, and it's got a nose bridge on it. There's a little display up here in the corner that you can look in. So you launch the glassware, and it immediately starts to play a tune for you, so you can keep time with the tune. And then in the display, it shows you a numeric figure for how fast you're doing compressions. So as you put your hands on the CPR dummy and start to compress, your display will change and show you the rate at which you're pressing. So what this project is aiming to do is to capture those metrics from the glass device and make them viewable to the CPR instructor on a web interface so that the CPR instructor can take a look and say, yeah, the student's performing up to snuff here. They're compressing at a fast enough rate, the rhythm is good, and their depth is good. So we'll display those three metrics on the web interface and provide the student and the instructor an objective tool to be able to evaluate performance of CPR. So this project goes for a week on medstarter.com, and after that, 3 finalists are chosen to present at the conference in Chicago in November. So take a little time and browse over the different contestants that are up on the website, and if there's something that sparks your interest, I'm not looking just for support for the EverMeds project here, because these are all valuable projects looking to help, cardiovascular disease and stroke problems in America. So take a peek on the website and see what you think, and if it's something that you feel like supporting, please do go ahead and support the projects that are up there. But this is really a new kind of paradigm in how CPR can be taught. So it's something that will allow students to gain a level of confidence, because right now when someone tells you, hey, you're doing a great job or whatever, you don't necessarily know that you're performing the skill quite properly. So it's good to have an objective measure and something that you can look at and say, this is my baseline, this is my target, and then get a printout of your performance so you can kind of critique yourself, and the instructor can give you instructions or guidance on what may be an area you need to work on. Maybe your rhythm's good, but you're not compressing deep enough, because it's really important to make sure that you compress deep enough to get circulation going through the whole body to reach the organs. So that's kind of the idea that we've been working on with this project, and if you just take some time and browse around on the website, it'd be great.
Well, can you show us a little bit about do you have a couple of slides you can show us of the actual Save a Life, or no?
Can I do a screen share through this tool?
Yeah, that would be great. Yeah. You just the green arrow at the upper left corner.
Okay, let me break out a.
Yeah, you can just go through your website if you want, and just kind of bring us through the app.
Okay, so.
You picked the wrong screen.
There we go.
There you go. Okay.
So this is the MedStarter website, and this is our project page. So we have a video that's posted here, and John, will this catch the video if I play the video?
Yeah. It'll play. You can make the screen actually a little bigger. Is that possible to make that screen bigger, to maximize the screen, or no?
Let me see.
Yeah, you can make it bigger there. You can make it 150%. Yeah, that's good. That's good.
Okay.
Yeah, we'll get a good picture there. And you can actually play the video and just stop it if you want and comment.
So this is the display on glass. Shows you an elapsed time on the right, and then this is the compression performance in the middle. Here's the actual view as you're providing CPR.
That's a doc you work with?
Yeah, that's one of the docs we work with.
Oh, okay.
So then we just go into a little discussion about, why it's good to have some verification on glass as far as performance, because a lot of healthcare providers don't get to perform CPR all that often. So when you're thrown into an emergency situation, you may not necessarily remember, how to exactly to perform that skill. And so with CPR glass, Save a Life glass, this is a good tool to help just be a refresher for people to get them, back into the feel and the rhythm of performing CPR. It's a great product and tool for skills fairs in hospitals. So these are like yearly events that go on where educators in the hospital validate staff and make sure the staff is performing various skills appropriately. So there's little blurbs here about the problem that we're addressing. There's different rewards that can be backed on the right-hand side of the screen here. And so at different levels of support, you can get either a download of the glassware, you can get some swag, stickers, bags, hats, those kind of things. And then for the actual CPR trainers or instructors, we have packages so that they can get a year subscription to the CPR application, not only for their glass device, but the web interface as well, and then be able to print off and share that validation of the performance of the CPR. So this this project, we did pull in some research that kind of points out, recently there's been a big push for hands-only CPR, and there's a few reasons for that. And one of those reasons is you need to keep the CPR going to be effective, right? So you need to make sure you're compressing at an adequate depth. So in this research article, it noted that when rescuers compress at a depth of less than 38 millimeters, survival to discharge rates after out-of-hospital arrest are reduced by 30%. So if you're not compressing deep enough, basically there's almost a third chance or increased risk of not surviving those events. And then also similarly here it says when rescuers compress too slowly, return of spontaneous circulation after in-hospital cardiac arrest falls from 72% to 42%. So these are significant drops in recovery statistics for patients who suffer sudden cardiac events. It's something that people think is a real basic skill, but lots of times people can't perform that basic skill very well to provide effective CPR and care to patients. So,
Chris, is it designed strictly for healthcare people, or civilian? Can civilians use it too?
So we have a reward level that will let you get a copy of the glassware for just anyone, but this is designed for healthcare providers and educators.
Okay.
So hospital training programs, individual CPR instructors. In my area here, lots of ambulance services provide CPR and ACLS classes.
Mm-hmm.
So that's one of the areas that we've been targeting as well, is the performance of, say, ACLS requires you to go through some complicated algorithms depending on the person's rhythm. And lots of times, in a high-stress situation, if you're on a general medical surgical floor, you're not going to experience those kind of events where you would need those skills much. But if you had some software that was able to interact with you and help you, guide you through, like right now you can download all these different apps on your smartphone, right? But that takes up your hands and stuff, and you need your hands during code events to do lots of different things, like starting IVs, providing compressions, drawing up drugs, administering drugs. So it's really good to have a hands-free tool, and Glass is a perfect platform for that because it allows your hands to be free. You can either talk to it, or I think in the video you may have seen that nifty little black device on my arm. That's a Myo. So this is a motion-controlled wristband that's coming out from Thalmic Labs. These are pre-release developer units. They were kind enough to select us as preferred developers. So you'll be able to interact with the glassware using this wristband. So right now you can interact with Glass and change screens by touching the touchpad on the side or speaking to it and saying specific commands. And so we'll be integrating this wristband into an ACLS protocol where you'll be able to select different options. Say, is this a VTAC or is this an asystole? What kind of rhythm does my patient have? So you don't have to be touching your Glass device all the time, and you can be doing other things with your hands.
Wow, the Myo reads the rhythms?
So the Myo doesn't read the heart rhythms. It does actually pick up the muscle impulses directly off your skin, though. So it's reading the electrical currents that your muscles produce, and then it takes those known kind of waveforms, and then we say, well, we want this particular, so say if you make a fist, there's a particular electrical discharge that your muscles are putting off because of the muscle groups involved, and Myo reads those and says, okay, that's going to now be this command, like am I going to select something, or am I going to slide through a menu item? So you can swipe left or right with your hand and scroll through a menu. It's pretty interesting. This also has some other really cool research applications that we're going to be exploring too. So with Parkinson's patients, I'm not sure, but you may be familiar, it's a big problem with movement. And on the inside of this, you can actually see the metal pickup pads here for the skin. So we're going to be putting this on Parkinson's patients and having them just wear it, and we're going to log their tremor activity throughout a day over a series of days. So we can see based on time of the day they take their medicine, stress factors in their lives, weather patterns that are coming in or going, what affects their tremors. Because with Parkinson's, they have these ebbs and flows, kind of like Alzheimer's, where they have good days and bad days. So we just are looking to start this baseline research and get data that says, this is what's happening with these people and these patients. And so we can start from a very simple concept of, well, let's just log the tremor activity and see what's going on. Then we can extrapolate from that and see if we can do individualized dosing regimens for patients, where we, on the fly, are able to modify doses and have doctors tweak their dosages to increase quality of life for these patients. Maybe find different therapies that are more effective for handling some of their symptoms than just traditional therapies.
Yeah, it sounds like a good way to monitor the effectiveness of a medication, whether it's working or not, like you said. I have a couple of questions, Chris, and this goes to general use of the app. Is it for? I know you have one-person CPR and two-person CPR, so you have different algorithms for both. Hello, am I freezing up here? Hello, hello, hello. Testing 1 2. Hello, 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 hello. Hi, Chris. Hello. Hello, hello, hello. Hi, Chris. Hello, hello, hello. Hello, Chris. Hello, 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 hello. Come on, come on. Hello. Hi, Chris.
Hey, what's that?
Yeah, Chris. I think we had a problem with the Mayo band of the internet.
Yeah, definitely, definitely.
One
Such is
question.
life with technology.
Yeah, you mentioned the Mayo application of the Mayo to Parkinsonism. Is that used also for prosthetic devices? You know how they can pick up electrical currents from the stump of a prosthesis, seems to read the electrical current so they can move. Do you know anything about that or no?
I don't personally, but that is a very intriguing idea.
I think that principle may be used with prosthetics because I don't know much about it, but I just read or heard how they're using electrical currents to help move the prosthetic device.
Yeah,
Uh,
some kind of neural interface.
yeah, yeah. So I guess
Oh,
it's
fascinating.
a learnable thing. A couple more questions. I was asking the question about a 1 and 2-person CPR. I guess they have different algorithms on the glass for each one.
Yeah, so we can customize the protocols basically. So some of the next steps, we have two distinct applications right now that we'll be merging into a unified one. So on one side we have the Save a Life application that does the rhythm tracking, the rate tracking, the depth tracking, provides you the audio and visual feedback. And then on the other side we have this protocol tool that's like a decision tree that you're able to go through and say, you know, do I have VFib or asystole or am I bradycardia? And then you are able to, from there, and based on your first choice of rhythm, get displayed and brought into that particular ACLS protocol tree. So the AHA, they put out these protocols for guidelines and care, basically, and it says this is your first step, this is your second step. If you do this and nothing happens or something happens, then you go to this next step or that next step. So we'll be tying the two applications together. So we'll integrate. I don't know if you were able to see on the video, but with the Save a Life application, there's a timer in the right-hand side that lets you know how much time has elapsed since you've started CPR.
Right.
And lots of stuff in these algorithms is based on timing. So using the timers, we're able to stop care and provide prompts. Either check a pulse, check a rhythm. Do I have a rhythm back? Yes or no. If I have a rhythm back, what's the rhythm? And then do I need to give a medication based on that rhythm, or do I just need to do other supportive measures? So then the protocol application will be able to guide and direct you. What's the next step in those scenarios? Because right now, even in a best case scenario, you've got 5 or 6 people in an ACLS code situation, and there's a lot of confusion. Even for a team that's worked together, significantly, it can be a very stressful and harrowing experience. So to have a tool that is able to prompt you as to what step is next, so you're not always thinking, well, what was the last medication? I gave epi once. Do I need to give it again? Is it time for some lidocaine? Do I need amiodarone now? There's all these different things that come into play with those rhythms, and lots of times people are hunting for this information either in a drug reference book or they're trying to call up the pharmacist, and it really delays a lot of care in code situations. So if you're able to have team members that have this tool with them that is able to guide and direct them in the proper care, hopefully it should not only speed care delivery but also the quality of care that's delivered, and therefore lead to better patient outcomes.
So it's a lot of the value is for teaching, correct? In the ACLS courses?
Yeah, so a megacode situation in an ACLS course is where this application would come into play. Can help really build team cohesion, confidence in individual team members and performance of their roles, whether your role is doing compressions, your role is the medication nurse, your role is the pharmacist, or you're the team leader. There's different roles that you'll be able to use and kind of have a concerted effort with the glassware. So you'll be, somebody puts a glass on and they're the team leader. They're the ones that are giving the orders. Okay, now it's time to give epi.
Right.
And then that order goes to the pharmacist, or it goes to, the medications nurse or whoever.
Has it been used in the live setting now? Is that Keith?
Yes, sir. Hi.
You finally got in.
I did. Thanks. Y'all continue. I'll listen in.
Okay, this is Chris Vukim. This is Keith. He's a nurse that does a podcast.
Oh, hi, Keith.
Hi there.
Yeah, so we're just talking about some CPR here.
Yeah, we're chilling it up. Chris, is anybody using it in the program yet? Any ACLS course using it yet?
So not in a complete course. We have done testing in ER and in SimLab settings. So we have professionals that have used the device, and we've modified the algorithm or the program based on feedback from individuals that have used the program. So you take out a situation where you would normally be going through a CPR instruction, and then we've gotten feedback from those individuals as they've used the glassware in a typical CPR education setting.
Well, that's good. Okay, so one more question here. I guess, I haven't taken ACLS for a couple of years. Has much changed? Have you taken ACLS lately?
I took it a year and a half ago last. And
okay.
There was some modifications. I think the last update was 2010 before the previous update that I think came in 2012. So there was some medication administration changes that were made. There were recommendations on dosage and preferred drugs for different rhythms.
Okay.
So very minor tweaks, not quite as extensive as for the layperson in hands-only CPR, which was a huge change from basically this I think a modality that had been around for some number of decades, with the rescue breaths included.
Well, bicarb used to be used. I don't think it has any place anymore, correct?
Bicarb very rarely.
Very rarely, yeah.
Yep, I think there's only one rhythm that uses that.
Okay,
Yeah.
so it's still in the bag.
It is still in the protocol, but it's one of the minor medications.
Okay, are there any other glass apps in the? You're in like a contest, right? With 9 other, and the contest. When does it take place, or is it over?
It launched today, and it
Okay.
goes through the 7th of October here, and then at the end of that, 3 of the companies involved will be selected to progress to the American Heart Association Open Innovation Challenge Conference in Chicago on November 14th to present their ideas and concepts there.
Okay, so people can tune into the site and vote?
Yeah, kind of. Voting is done through support at this stage, basically.
Oh, okay.
So every project has different contributions that can be made. Typically, they start out at very low dollar amounts, and either you get some kind of a product or an application. I know one of the contestants has basically it's like a treadmill, but for when you're sitting. So these are kind of like workplace type or ergonomics and those kind of things to improve cardiac health for people that spend a lot of time working in sedentary positions and things. Some other things are applications for tracking and monitoring heart conditions and those kind of things on a smartphone app. I know another project was a thyroid. It basically checks low thyroid levels.
Okay.
So there's some kind of like quasi-medical devices that are seeking either FDA approval, and this is part of their process where they're looking for support for their product to test it out on a larger scale, that kind of thing.
Okay, what's the website the people can go to?
It's MedStarter,
Okay.
MEDR.com.
I'll tell you what. Let me try to get it on the web, and I'll screen share it.
Oh, excellent.
Yeah, I've been up. I think I've been to that site. And
yeah, they've been around for 5 or 6 years now. It's a group of folks that Kickstarter and Indiegogo and stuff. Those platforms are pretty restrictive about the medical type products that they'll allow on.
Okay.
So MedStarter was formed and launched in response to those policies. There we go.
Okay. I've seen the head of this project. What do you know? Remember his name?
Yes, Alex Fair.
Yeah, he's all over the place.
Yes, he is an extremely busy man. Very involved in Health 2.0 applications and conferences and things.
Okay, and this is basically a crowdfunding site?
Yep, for healthcare projects.
Okay. Okay, very good.
One of the projects that they do have up too is a really cool new concept for EKGs. It has a different kind of setup. In typical EKG, you've got to hook up 12 leads, and it's very, even the techs that are trained to do it and stuff, they're constantly looking at the device where it's got a decal stuck on it that shows you where to put each
right leg, left arm.
Yeah, it's so hard to remember which lead goes where.
Right to right to red. Yeah, this is very confusing.
It's crazy. So they've got a very interesting concept where it's more like a glove that goes over the chest. But that's one of the projects that's part of this American Heart Association Innovation Forum as well.
Very good. Well, Chris, I thank you for coming out again tonight.
Thanks for having me.
And very good luck in the contest. And we'll see you again here soon when you have another project.
Excellent. Sounds great. Have a good night, guys.
Okay, hang in there.
Good luck, Chris.
Okay, hold on, guys.